Welcome back to The Way Home. Well, this coronavirus has been about a 6-month ordeal for the entire world, and we've learned a lot about how it affects a person, whether it's respiratorial or with other symptoms, but we haven't heard a lot about what maybe it is also affecting. And so I have a great guest today, Dr. Babak Jahromi. He's a neurosurgeon at Northwestern Medicine. Dr. Jahromi, thank you so much for joining us today.
Thank you and your listeners for having me.
Well, so like I said, we've all been hearing, we're learning, everybody seems to be learning together, but obviously the doctors, the researchers, and the surgeons all on the front line are probably learning a lot more about this novel disease than many of us know. You being on the forefront of that, tell us what some of your findings have been and what you're helping neurologically with your patients and other organs that have been affected from the COVID virus.
What we and other centers have found is COVID not only attacks the lungs, but as a secondary effect causes what we term a hypercoagulable syndrome. Basically, it makes blood clots form in the blood vessels. And so imagine blood vessels as the plumbing for the entire body, and it causes blockage in the pipes going to the rest of the body. So if it blocks the pipes going to the heart, that causes a heart attack. If it blocks the blood vessels supplying the kidney, that causes renal disease. And in my specialty, it has a predisposition to block the blood vessels going to the brain and starves the brain from nutrition, oxygen, blood flow, and causes strokes.
Now, is this something that has been seen for a while since the beginning of the virus here in the country? Have you seen this from day one, or is this something that's just sort of unfolding and coming to the forefront now?
We suspect it's always been there with COVID infections, but as experience in the United States has grown with COVID, we've also seen a rising number of strokes, even in younger patients we wouldn't have expected. This was first noted in the epicenter of COVID in the United States in New York City, but as the numbers have increased across the country, pretty well every major center has now experienced this kind of unexpected stroke in younger patients with harder to open blood vessels due to this effect of COVID.
Yes. And what would you say are some of the signs that people might be able to perceive that either they're having a stroke or somebody who's with them?
I'd ask your listeners to memorize the acronym F.A.S.T, F-A.S.T. So each initial stands for a warning sign of stroke. F stands for facial droop, so a crooked smile, a drooping face. A stands for arm weakness, so not being able to hold your arm outstretched in front of you, you use your hand. And S stands for speech, unable to understand or speak. If any of these occur, then you've got to think of T for time and call 911. In a large vessel stroke, the brain is dying at 2 million brain cells per minute. Time is of the essence. The sooner you call 911, the faster you're in the hospital, and the more brain we can rescue to maximize your chances of recovery.
And what are the percentages of people that contract COVID that actually come down with these types of symptoms and indeed maybe have strokes associated with the disease?
So we're seeing major strokes occur in 1 out of 50 to 1 out of 100 patients that are hospitalized with a COVID infection. But if we expand that net and look at any neurological disorder, even mild to moderate symptoms such as confusion or even delirium or neuropsychiatric disorders like psychosis, anywhere between a quarter to half of patients with a severe COVID hospitalization will exhibit these symptoms.
Well, what is Northwestern Medicine doing to help mitigate these circumstances, and what kind of what hope can you give us?
We're really approaching this in two aspects. One is, frankly, a huge public outreach effort, such as being on your show. We want patients and the population to remember, despite it being a pandemic, you can't ignore stroke. If you have the warning signs, remember the acronym FAST, call 911. The hospitals are ready to provide the best care possible. For example, at Northwestern, we have completely redone our ICUs, the air ventilation, the flow, the multidisciplinary teams looking after these patients. We are here ready to provide care for COVID patients and for non-COVID patients, so that doesn't affect how care should be provided. If you have symptoms, call. That's the biggest thing. Internally, not only have we gotten the separation of patients and different airflows and enhanced team ability to look after these patients, we also know that there's a high risk of stroke. We'll use judicious blood thinners in these patients to decrease the chance of blood clotting occurring, leading to strokes. And if a stroke occurs or if somebody comes in with a blocked blood vessel, we are ready to rush to the operating room and open that blood vessel without wasting time, while simultaneously using all of the extra PPEs required for our nurses, technologists, and surgeons opening these blood vessels at the same time. So, message to our listeners is, do your part, call 911 if you have the symptoms, and in the meantime, adhere to social distancing and masking and help reduce the rate of infection and spread.
Absolutely. And I know there was a long time where people were afraid to go or call with symptoms other than if they thought they had COVID, because they were afraid of overwhelming the hospitals and or even contracting COVID. Do the hospitals really have that under wraps at this point?
You really hit it on the head. Even though there's more strokes happening, there were fewer people calling us and fewer people coming in. So the clear-cut message is, we have it under wraps in most hospitals. There may be very rare occasions where in some of the true hotspots, remember New York a number of months ago, hospitals were overwhelmed. We are ready to care for you. That should not be a consideration. If you delay coming in, it's worse for you, it's worse for us. Call us, come in as you need it. We're ready to provide you the care.
Fantastic. And if you could just tell us, Dr. Jahromi, how we can, find out more information on this, an easy to get to website or such.
I'd ask your listeners to go to the website stroke.nm for northwesternmedicine.org, a great source of information on warning signs, stroke prevention, healthy lifestyle, and stroke treatment, and also the CDC. Go to the cdc.gov for a unbiased, wonderful source of information on COVID signs, self-screening, and all the basic information you need to get yourself and your loved one through this pandemic.
Wonderful. Thank you so much for being with us today and reminding us how important it is to keep our eyes open and really take things seriously if we have them, by all means. Dr. Babak Jahromi, neurosurgeon at Northwestern Medicine, thank you so much for being on the way home.
Thank you to you and your listeners for having me.